Hello everyone, Dr. Mark here with you again. If you have a 24-hour pharmacy close by, then you can probably get OTC medications for your dog whenever you need them. For those of us that live far from town in a rural area or live in a small town that is not open 24/7, keeping these drugs in your pet's first aid kit can prevent a lot of problems and may even save your dog's life. There are several that are safe to use, but I will list the 6 most important medications you should keep in your dog's first aid kit. The first is just Benadryl. This antihistamine does not always work in allergic dogs, but I recommend people keep it on hand as one of the side effects is making dogs drowsy. If your dog is allergic to something in the environment and is chewing the paws or scratching the ears or underarms excessively, a small dose of Benadryl will make him or her a little more relaxed and allow all of you to get some sleep. Do not buy Benadryl D, which has a decongestant that is toxic to your dog. The second thing I always want on hand is Pedialyte. This is something that should always be on hand for our fur babies. Pets with diarrhea can become dehydrated very fast, and although Pedialyte can be overdone, if you only give about a tablespoon for every 10 pounds of body weight, you can replace a lot of the electrolytes a dog with diarrhea will lose. I prefer to give a dog's stomach a rest for about 24 hours and not give any meds or electrolytes if they are also vomiting. But if they are having very loose explosive diarrhea and you cannot take them to the vet, this is a good thing to have on hand. Do not use any of the sports drinks instead of Pedialyte, but if you have access to real coconut water, that is an even better alternative than Pedialyte. I have a lot of doubts on the ingredients in products that claim to be coconut water, so try fresh coconut if you have it. The third product is betadine. When dogs have a cut or other injury, the first thing to do is clean it with clean water. Do not leave it until the next day when you are going to take them to your veterinarian. You will need to flush out any gravel or any foreign bodies with water as soon as you see it, and then remove most of the bacteria that has contaminated the wound by flushing with dilute betadine. There is some concern in that betadine can be cytotoxic. It can damage cells, but if used very dilute, the color of weak tea, it will not cause much tissue damage and is better than dealing with an infection. The fourth is triple antibiotic ointment. This is not really needed after cleaning a wound, as it is much better to remove the bacteria and then apply coconut oil so that it will be moist until you can have the cut sutured the next day, if necessary. What I have found this ointment useful for is dogs that present with hot spots. After the hair is clipped and the wound is cleaned, you can cover the surface of the affected area, and about a ½ inch onto the normal skin, with triple antibiotic ointment. Do not do this if the hot spot is on the belly or leg where the dog is just going to lick it off. Just apply coconut oil. The fifth is something I hope you never need, but if you do, you will be glad to have it on hand, and that is activated charcoal. This is something that can make a lot of difference in cases of poisoning. The activated charcoal will bind with some poisons when still in the stomach or upper small intestine and prevent them from being absorbed. This only works on some poisons, like rat poison, chocolate, and Tylenol, so if your dog has swallowed something, you need to call your local vet or poison control before giving this medication. If it is not available from your local pharmacy, veterinarians have it in stock and most will sell you a bottle to keep in your emergency kit. The sixth and last is hydrogen peroxide. This can be used in cases of poisoning to encourage your dog to vomit. There are a lot of nasty side effects, and not all dogs should be encouraged to vomit after consuming a poison, but if the alternative is death, then it is worth trying. There are better medications available from your vet, but this should still be kept at home if you cannot take your dog to an emergency vet. If you cannot consult a local vet, you should call poison control. Do not use this if your dog has a flat face like a French bulldog or pug, as they are more likely to inhale when vomiting and thus are more likely to die from inhaling vomit. Hydrogen peroxide is also great for cleaning up blood around a cut, so if you are just using it to remove blood, that is fine. Do not apply it directly to the wound though, as it will cause a lot of cell damage. Some of the other OTC medications that are safe for your dog, like Pepto-Bismol, Tagamet, and Imodium, are not really needed in an emergency and can be purchased later when needed and only given after consulting with your regular veterinarian. If your dog has any health issues, like congestive heart failure, kidney disease, or an autoimmune disease, and is being treated, be sure to discuss the things on this list with your regular veterinarian. There may be something specifically going on with your dog, so you do not want to wait until your dog is sick and you end up calling an emergency veterinarian that is not familiar with your dog's history. Thanks for watching. If you have any experiences with OTC medications and feel there should be something else on this video, let us know in the comments. If you have any questions about your dog's health, you can send them to my Ask a Vet column at yourpetsathome.com. Be sure to let us know the dog's age, sex, breed, and the results of any testing you have already had done. If you have the time and enjoy learning about dogs, take some time to look at the videos in my profile page.